Assalamualaikum warahmatullahi wabarakatuh. Good morning, good afternoon, or good evening for all teaching team and all my friends. So today we are from group 3, want to presenting about orthotic case. Next slide. Here are the group members. They are Asyraf, Afif, Firmansyah, Gemila, Zahra, and myself, Andini, and there is Tiara. So here also for the table of content, first case summary, second clinical problem and goals, 3 PICO questions, 4 summary of 2 evidence source, 5 critical appraisal, 6 clinical recommendation, 7 outcome measures and follow-up plan, and last is references. So this is for the case summary. Next slide. And the clinical problems that we found, and we set the goals. For the problems, we found persistent plantar ulcer due to high plantar pressure, risk of worsening charcot deformity and amputation, and patient refuses use gold standard TCC or total contact cast. And we set the goals for there are promote ulcer healing, reduce plantar pressure, maintain full stability and mobility, prevent further deformity and complication. Next slide. And here's for the PICO question that we found from the case. In patients with diabetic charcot neuroarthropathy and plantar ulcers, does the use of a total contact cast or TCC or custom offloading orthosis compared to wearing loose footwear or no orthotic intervention improve ulcer healing and reduce the risk of amputation? Okay, here is for the slide summary of 2 evidence sources. First, for the title is removable case Walker boosts yield greater 4-foot offloading than total contact case. Why is it relevant to the case? Because it directly compares TCC and removable boot for diabetic plantar ulcers, highlights how offloading and compliance affect healing outcomes. And for the evidence source 2, the title is effectiveness of removable Walker cast versus non-removable fiberglass of bearing cast in the healing of diabetic plantar foot ulcer. Why we select this evidence? Because it evaluates a specific removable device, its stability versus TCC, and it shows removable device can be effective when used correctly and consistently. Here is for the critical appraisal, and it will be presented by Firman.
Okay, thank you, Roro. So we do a critical appraisal. We do a critical appraisal on the first article is on GBI critical appraisal checklist for RCT, or you can call it randomized control trials. That overall answer is yes, but you can highlight the number 4, number 5, and number 6. So the reason the answer is no for the number 4, because the study was described as open and patient could see whether they were using a removable walker or a non-removable cast, it making blinding impossible of the article. And then for the number 5, why the answer is no? Because the treatment administrator had to fabricate and fit different offloading device, so blinding was not feasible. So for the number 6, why the answer is unclear? Because the article doesn't specify whether the staff measuring ulcer size and assessing healing were blinded to the treatment group. So I think that's all from the critical appraisal of article number 1. So for the next critical appraisal for the article number 2 will be explained by Gemila. So Gemila, time is yours.
All right, thank you, Firman. So this is critical appraisal second, GBI critical appraisal checklist for the control trial. The first is, what's the random size used to excitement of participant of the treatment group? The answer is yes, similar 1, 2, 3, but I want to highlight only a few, like for the number. Yes, this is where participant blind to treatment assignment. The answer is no. Why? Because the participant were not blind because they could see and feel the different the equipment used. I mean, like total contact cast and case walker about are very different in shape and use. And the next 5 were those delivering treatment blind to treatment assignment. The answer is no. Why? Because the medical personnel or research who fit in the device knew which device was within each participant, as fitting the TCC and CVB required different procedure. And the last, I think, highlights Question 7 is, where outcome is blind to treatment assignment? The answer is no. Why? Because the outcome assessors knew which group each participant got after random size. As blinding for the assurances was not mentioned in the article. Right, the next presented will be delivered by Afif. Afif, time is yours.
Okay, thank you, Gemila. The next is clinical recommendation. First clinical recommendation is offloading the device. Prescribe a removable case walker boot to offload the midfoot ulcer. The second is adherence plan. Educate the patient that success depends of wearing the boot almost full time. Set clear wearing schedule and provide demonstration. And next, mobility aids. Offer an assistive device to minimize pressure when out of cast. Next, clinical recommendation is wound care. Continue routine ulcer care. Manage infection risk despite current absence. Next, medical management. Optimize glycemic and blood pressure control. Encourage weight loss. BMI 35 to reduce food stress. And last, comfort measure. Since the patient is sensitive about comfort, provide cushion liner in the boot and allow short supervise of boot break with protective footwear. Okay, the next outcome measure and follow up present by Tiara. To Tiara, time is yours.
Okay, thank you, Afif. And this slide is outcome measure and follow-up. Ulcer healing, track ulcer size and depth, weekly photograph, wound measurement until complete epithelialization. Pressure offloading, if available, perform in-shoe pressure mapping to confirm reduced plantar pressure under the ulcer. Device use, record patient report horse per day of boot wear. Assess wear pattern or intentional removal. Next slide, please. Charcot progress. Obtain follow-up foot X-ray every 4 until 6 weeks to assess bone healing or stability in the Charcot joint. Sensory and vascular check is repeat monofilament exam and check foot pulse at each visit. And follow-up visit is weekly or bi-weekly podiatry or wound clinic visit initially. Once the ulcer heals, transition to a plan for durable protective footwear, custom shoe, or a Charcot residual brace.
Okay, thank you, Tiara. So this is for the reference that we took for made the PPT, and it's from article itself. Now we want to explain to you guys how to find an article and also how to find a journal level on Simago website and how the level or quartiles is it. Okay, so we move to the next session, how to find an article. So first you have to find a keyword first, because because we have a patient that he has plantar foot ulcer, so we need to find in Google first plantar, is it in caps lock? Plantar foot ulcer article, and you can find some or maybe all of the article that you need. So we need to pick one. For example, you can pick this one: offloading strategies used for plantar diabetic foot ulcers and their outcomes in real life clinical practice. But you also have hesitation about it, so you can check Simago for the journal rank and the Q level. Is it Q1, Q2, Q3, or Q4? So for example, this one is Journal of Clinical Medicine. We need to find it. Clinical Medicine. Here it is. Here are the results. And this one is that I'm searching for. And you click it. After that, you can scroll down and you can find that they have Q1 as corpus score. See? And this is for the graphs, for the quartiles. They have quartiles, as I said before. And that's all. Thank you.